Good morning and welcome to today's webinar with special guest Professor Martin Green, who is the CEO of Care England. My name is K Steen. I am the Sales and Marketing Director for Redwoods Darling Care, and I would like to thank you all for joining us this morning. During the webinar, if you have any questions which you would like to ask, please write them in the question box which is on your screen. And we will have time towards the end of the webinar to discuss any questions which you have or which you may wish to ask Martin. Martin, before we begin, would you please start by introducing yourself and Care England, please?
Yes, certainly, Andrew, and thanks very much to you and RDK for putting on this seminar. I'm Martin Green and I'm the Chief Executive of Care England. Care England is a representative body for care providers, and we have over 4,200 care services in membership. We have quite a lot of residential care for older people, a significant amount of residential and supported living for people with learning disabilities, some brain injury units, and also some mental health services. We cover both charitable and private sector. So I think we've got a really good overview of what's going on in the care sector. And that's why I'm really welcome this opportunity to talk about some of the issues around COVID, though I really want to focus on the lessons learned rather than a post-mortem about what went wrong. Though, of course, we will talk sometime about that as well.
Brilliant, thank you for that. Last week marked 7 months since the UK was placed into an initial 3-week, which became 2-month lockdown due to COVID-19 pandemic. In March, the decision was taken by the government to protect the NHS with a strategy aimed at significantly increasing bed capacity ahead of the expected surge in COVID-positive patients who would require NHS care. This strategy created widespread issues for the healthcare sector, many of which still exist today. Martin has prepared a presentation where we will discuss the key COVID-19 issues before looking ahead to Martin and Care England's thoughts on the future of the care sector. Martin, over to you. Would you please start by discussing the key issues?
Yes, certainly. Thanks, Andrew. And can I go to my first slide, if I may? And as I said, I really want to focus this on what lessons were learned at the start of this pandemic and how we can strengthen our response, not only to what's going on now, but how we can think about how to improve things in the future. The point you made about the government strategy focusing on the NHS, I think, was one of the big challenges we faced at the start of the pandemic, because what became apparent as we began to think about how we were going to respond was that very many people who were at most risk were not actually in the NHS. They were in social care services. And one of the fault lines that really was exposed at the start of the pandemic was the lack of integration between social care and the NHS. I think we should also acknowledge that it wasn't only about the lack of integration, but it was also about the way in which the NHS withdrew from care services at the start of the pandemic. I saw letters from GPs and from primary care which said to care providers, we will be withdrawing all services, we will not be doing consultations, we will not be sending people to hospital, and basically you're on your own during this pandemic. Now, given that we knew, and in fact the Chief Medical Officer has acknowledged this, we knew that those at most risk of this pandemic were people who had multiple health conditions, and particularly who were older, and yet those people were pretty much abandoned by the NHS. There's been a really significant attempt to change that, and we're starting now to see a much better approach. But I do
Martin, yeah. Sorry to interrupt you there. Which point do you think the government finally realised that the strategy they were following was having significant, a significant impact on the healthcare sector?
Well, I think it was when the death rates in care homes were first plastered all over the front page of the Daily Telegraph. And it was interesting because I gave the Telegraph what I knew were my death rates, because I had data coming through to me. Now, at the same time that I said 7,000 plus people had died in care homes, The actual official statistics from the ONS were saying 214 people had died. And that was because there was this massive gap between the figures that the ONS were delivering and the timing of them. So they were delivering 12-day out-of-date figures. So when those figures really hit the public domain, that's when both politicians and indeed the whole system really began to think we have a problem in social care. And that was why the response was changed, I think.
Okay.
I also want to say that one of the other fault lines that's appeared is the lack of understanding of social care of some of the quangos surrounding government. Now, I think one of the things we've really seen in this pandemic is that a lot of those quangos are pretty unfit for purpose, and they were unfit for purpose in the best of times, but they're certainly unfit for purpose in the crisis that we're currently in. I mentioned the ONS. I do not understand why in the 21st century, in a digitally enhanced system, we can't have real-time data. And there seems to me no excuse to have data that is 12 days out of date. We also saw, I have to say, that when that data hit the press and suddenly there was a political knee-jerk, the Care Quality Commission came forward and said, oh, we can give you daily updates on that. Well, that raised the question for me, why didn't they proactively do it at the start of the pandemic? Public Health England was thoroughly incapable of delivering guidance for the care sector. So they were very late in doing it. And when they did it, it constantly changed. And partly that was because they didn't know what they were delivering guidance for. So we saw situations where the guidance on PPE was changing sometimes 6 times in the space of 48 hours. Well, that was because it was written by people who didn't know what they were doing. Now, one of the things that I think has come out of this is that those quangos need to connect more with social care, and they also need to co-produce things with social care. My colleagues and I gave them absolutely lots of opportunities to say we'll co-produce things. Similarly, colleagues at NCF, colleagues at NCA, UKHCA, similarly were saying we are here to help. But because the system and the quangos are absolutely incapable of making instant decisions, they constantly go back to process. So in a situation like we're currently in, you need people who can make very quick decisions, and the system is not set up to do that. So that was another fault line that was really shown.
Do you think that that is a lesson that's been learned, or do you still see it as an ongoing issue?
I think it's a lesson that's being learned. We saw that there was a knee-jerk reaction to completely change Public Health England as a result of what went on in the pandemic. I have to say, I think we need to do that, and I think we need to look at all quangos, but I wouldn't do it in the heat of battle. I wouldn't necessarily rearrange the deck chairs on the Titanic as it's sinking. I'd probably wait until things have settled down and then take a reasonable look at how we reform things for the future. Okay. The other issue around the architecture not being fit for purpose has also translated into some issues around a loss of confidence in the care sector. So, for example, if you have a situation where the ONS deliver figures that say 214 people have died in care homes, that looks as if there isn't too much of a problem in care homes. Then you see, oh, 7,000 people have died, and then suddenly there are 15, and then 20,000 people. What that does is it grabs the headlines and it undermines the public confidence in social care. And what people then get is a message which says, if you go into social care, you're probably going there to die. Whereas there is a message that people have always got over many years, though it's not true, that if you go into the health service, you come out cured. So that lack of public confidence has had a real big impact on occupancy levels. So we've had both a great deal, tragically, of deaths in care, and then we haven't had a pipeline of people coming into care, partly because there's been a lack of confidence by families, partly because there hasn't been the normal structures involved in local authorities doing assessments and commissioning care, partly as well that there hasn't been a lot of elective surgery or people going into hospital at crisis points, so there hasn't been the normal flow. And certainly
Martin,
occupancy levels are really a big issue.
Just on that point, which is interesting, in the last couple of months, we have seen some significant growth in domiciliary home care businesses as a result of the pandemic. And I do wonder, off the back of what you've just said, whether that is family members who are deciding to try and retain care at home as opposed to going into a care home.
Yeah, it could well be that. I also think there's been another factor, which is that a lot of families have found themselves furloughed and they've been able to support people. Now, when all that comes to an end, they'll begin to realise that, first of all, the level of dependency is such that people can't be managed by their families, and in many cases they can't be managed in the community. So I do think there will be a sort of return to normal occupancy levels, but it will take a lot of time, and that's why I think we've got to have a bit of a short-term fix on how we make sure occupancy is maintained or guaranteed.
How immediate do you think that'll be? Because obviously the true furlough scheme, or the coronavirus job retention scheme, to give it its full title, ends at the end of October, and the replacement scheme, which for certain sectors has been improved in the last week, is nowhere near as attractive. And I think I saw some statistics this morning that said 1 in 5 young adults have lost their job already, who were on furlough. Do you expect an immediate bounce, i.e. from the 1st of November, in terms of occupancy, or do you think it's probably going to be more of a New Year initiative?
I think it's going to take a while, and what I've said to the government is they need to have a strategy which actually is between 12 and 18 months in duration, and I think it's going to take that long to bring occupancy levels back to where they were. But of course, the other thing that became very apparent in the pandemic as well was that the funding and commissioning of care is not very well done, being left to localism. You know, the problem here was that localism has shown itself to be completely not the best way forward in a pandemic and in a crisis. I always draw the analogy, if Churchill had said to every local authority with an aerodrome in its area, you can decide when the planes go up for the Battle of Britain, well, I'm afraid we'd have lost. And similarly, we've seen endless bureaucratic processes, local authorities saying you can do this, you can't do that, and public health directors making it up as they go along on things like visiting policy. And this is really unhelpful to the care sector. So I think we've got to change some of the funding models, and we've got to take a long, hard look at localism. What was also interesting, Andrew, which links to your previous point, was this pandemic has really identified the data gaps, and there is loads of data about the NHS. There is such little data about social care, and we've got to close that gap. We've also got to use technology much more effectively. That's starting to happen, and on the data and technology front, the pandemic has actually driven much more fast adoption of things like NHS mail being available to care homes, etc., and also care homes using technology, particularly around things like consultations, virtual consultations, connections with families being done virtually. And of course, there's no substitute for that connection on a physical level, but there are lots of people whose family might live in Canada. And so now we know how to keep in contact with people who might be a long distance away. We'll be able to keep that going well after COVID is over. Okay. And then the final thing I think really came out of COVID, which we need to stop for the future, is this endless government approach to making announcements with no understanding of how they'll be delivered. So you would have an announcement being made, and then suddenly people scrabbling around at the Department of Health and Social Care and NHS England and people in local authorities thinking, how are we going to deliver this? So I think one of the big lessons from COVID is that if you're going to make an announcement, have the delivery route sorted out before you make that announcement. And that's something I think, is a lesson learned. But okay. I said at the start of this, Andrew, that I also wanted to be really mindful of this being our platform for the future. It's very easy to be the Cassandra on the sidelines saying, well, it was all horrible and nothing came of it. So one of the things I want to do is to say, what have we learned during COVID that can be the foundation for the future of social care? And if I can go on to my next slide.
Okay.
I really think that this pandemic has really shown that there has to be some reform and revision of social care. And I think the government really now understands that. And I believe that we as a social care sector need to really start from year zero in how we develop our reform approach. Now, we've all lived with the fact that it was Tony Blair in 1998 that asked Lord Sutherland to find a solution to social care, and every single government and every single prime minister since has completely fudged the issue. I would argue that in doing that, that has created some of the challenges that we face. Now we're in the middle of a crisis. But I think the crisis has meant that the government now knows it has got to reform the system. What I would say, though, is that often in this discussion about the reform of the system, we all start talking about the money first, and I think that's a major mistake. I think what we need to do is we need to start creating a new vision for social care, and we need to be really clear what social care is there to do, how it transforms lives, how it supports people to be as independent as possible. I think there's also an issue there about how we connect with how important social care is in local economies as well. You know, too often our debate about social care is framed in what it costs government, but actually we should also remind ourselves of what it contributes to local economies. So a good example of this, if you take a frail older person, and they may be living in a local area, they might be housebound, and they might be getting some support from domiciliary care, which they're paying for themselves. Now that is a trickle of money into the local economy. They then might need to go into residential care and perhaps spend £1,500–1,800 a week on their care package. That is money that is now gushing into the local economy. It's providing employment. People who work in social care, predominantly they live in the locality, so it's also about them spending money in local shops and local businesses. So I think we should also remind government that this isn't only about a burden, but this is about an economic generator. And if you look at the numbers of people in social care who pay for their own care, it's a really significant amount of money going into local areas.
I think, I mean, obviously you start with an argument and you can go much, much broader, because obviously if there are working age family members caring for their parents or grandparents, that frees them up to work in the labour market, which obviously is good and beneficial because it increases their spend, their local spend in the community. But in addition to that, obviously people who are of an age or who are with healthcare professionals, be it domiciliary or be it care homes, are less likely to excessively use GPs because they've got a level of care. And, you know, I think you've got to take a holistic view of what care is worth. And also there's the position of if they're in care facilities being cared for and they're not blocking beds, you know, how much does an NHS bed cost per week versus how much does a healthcare bed cost?
No, exactly. And I think all those things need to be part of this revisioning of social care so that it starts to be about positives, not negatives. And so often it's always framed in the money first rather than that new vision for social care and what it delivers in terms of outcomes. The other thing that I think we've got to move is there's a lot of talk in the system about personalised and co-produced care, and yet what tends to happen is somebody sits in a local authority office and decides what Mrs. Gubbins needs, or they discuss what they think they've got available. What would be a much better place to start is to start with the people who use services and their families, and to construct things that make things better for them. And if you do that, and of course a lot of that is done with self-funders, you then start to see that sometimes it's the smaller interventions that make the big difference to people, and they often find themselves using resources in much more effective and efficient ways when they are in the driving seat of what they need and how it should be supporting them. So I do think there is an issue about centralising this notion of a personalised and co-produced approach to care.
Mm.
The other area I think we have to really acknowledge is that we need to get more innovation in our sector. I think that lazy commissioning can sometimes lead to lazy providing, and I want to try and break that circle. So there are good examples. So the good example was a small care home that had only 30 residents. Now, this was not financially viable on local authority funding levels. So what they did was they got together a group of stakeholders from the local area. They had people who were living in their care home, their families. They brought together Age UK in that area, Alzheimer's. And they discovered there were lots of people who were supporting somebody living with dementia within a 3-mile radius of that care home. So what they then did was they started to develop some day services, some night support services, some information services. Through their partnership with Age UK, they got everybody who wanted to use those services onto a direct payment so that they had the money in their pocket to choose those services. That not only transformed their business model, but it transformed the lives of people in that local area. Of course, the other thing it did was it created a great pipeline of people who, because they knew that service, they knew the quality of it, they respected the staff. When they needed full-time residential care, that was their place of choice. So I think if we start to innovate and think about how we can develop new approaches, that will be another way that we will assure our survival as a sector in the coming years. And I think with innovation, what we need to do is do whatever we can to get rid of local authorities out of the equation. Local authorities serve the needs of local authorities. They do not serve the needs of individuals. And so what I want to see is a much more centralising of power at the centre, which is the person. I want to see the person being the definer of what's good for them, and indeed in conjunction with their families. So I think that needs to be part of the process, but also as a sector, we need to be listening to what people want and innovating and challenging our particular methods and our particular services and saying, are there ways in which we can tweak them, or are there ways in which we can deliver them more effectively? And I think that also leads me on to something which I said at the start of this, which was there is a real lack of integration in the system. The systems sit in silos, and we have seen that during this pandemic. The NHS sits in one particular silo. It does not connect with social care. And interestingly, sometimes the measures that we use to show whether or not services are successful are completely opposed to one another. So if I'm an adult services director and I develop a wonderful community-based service that stops people going into hospital, or if I'm a care provider that delivers all this wonderful day support and stops people going into hospital, I am not going to necessarily reap the benefits of that. The hospital works on activity, so the more people that go into hospital, the richer the hospital gets. The social care service that's stopping that, because it's good for people and it's good for the system, won't necessarily see the benefits of it flowing back. So I do think we need to have very clear measures of success that the entire system is working to. And when we get that, then we will get much better integration and much more seamless services. Though the other thing I want to say is I want to reclaim the term integration. When people talk to me about integration at the Department of Health and Social Care, they talk about local authorities, they talk about the NHS, they talk about care providers, but they do not talk about people. Now, the measure of success in integration is the experience of the person using the service. Now, what I use as my example is that when I fly, I go to an airport, it's owned by one company. I get on an aeroplane, it's owned by another company. I do not know when I leave Austrian airspace and go into German airspace. There is a massive administrative process going on in the background. But what I experience is a flight from A to B, and everybody is measured on that experience. So, you know, the air traffic controllers are measured on, does the plane crash or doesn't it? Am I safe or am I not safe? The airline knows that it's in competition with others, so it has to give me a good experience for a reasonable price.
That's a fantastic example, but you're citing the private sector, who will drive efficiencies and ultimately will drive that A to B philosophy.
Mm-hmm.
Do you feel that protectionism is at the heart of quangos, local authorities, civil servants essentially, that is the main blocker? Protectionism of budgets, protectionism of roles and responsibilities. Where I live in Lancashire, I mean, it's kind of hidden to some extent because of the whole Andy Burnham versus Boris debate, but we've not even got a mayor. We've got about 13, 14 councils that have all been arguing the toss. Meanwhile, there's a pandemic going. It's the same example for social care in Lancashire. They've all got to deal with all these local authorities, and they all want their say. If we're going to centralise and we're going to have quick decision processes, somebody needs to get a grip of the protectionism that's taking place.
No, I think that's very true. And I think also, you know, to be fair, we all are protectionist in terms of our own roles. And I think partly as well, people aren't offered the other scenario. So if you are just told, well, we're going to change something, but you don't know what your role in that change will be, immediately you will be protectionist. So I think what we do, and that's why I think we need to create this new vision for social care. There is enough for us all to do. It might be in different ways and in different contexts, but I think we do need to realize that some of that is about, you know, protectionism. And of course, it's really seen very starkly in lots of situations, not only in the public sector, but we need to remind ourselves what we're here to do. And we also need to remind ourselves that given the demographics, there is going to be more than enough for us all to do, but we might want to do it in different ways. So I think the narrative needs to be created about what the future looks like, so that people don't feel that change is an end for them. It might be the start of a new beginning. But I think the other thing there, Andrew, what I must say is I'm amazed at the proliferation of politicians. One of the things that always happens, and we always see it, so you have Devo Mank, and everybody tells us this will be the Shangri-La to integration, and everybody will be working harmoniously together. Well, what they did was they talked about how they could reduce a range of different structures, but they didn't talk about how they're going to reduce the number of politicians. They didn't talk about where the flow was in terms of power. So I went to a meeting in Greater Manchester once, and I said, well, supposing the mayor of Salford or the leader of Salford Council has a disagreement with the leader of, you know, Central Manchester or another borough in that conglomerate, presumably then Andy Burnham is the arbitrator of this. And they all jumped up and said, oh, no, he's not in charge of us. And we've seen it also with the London governance issue. I mean, I don't know why we don't either dispense with 32 London boroughs or get rid of the mayor and that nonsense, because at the moment what we've got is this proliferation of bureaucracies and politicians, but we don't see the benefit of it in terms of the outcome. And somebody who lives in London, acknowledging what the mayor's been doing about the inner cities, well, he's been destroying them single-handedly with his silly policies around, you know, cycling. And hasn't the idiot ever been on a railway station to know that, you know, huge numbers of people who work in London travel 70 miles? Well, they can't get on their bike and walk. So, you know, there are some really big issues here about accountability and about why we need all these politicians. And I wish somebody would, in the root and branch reform agenda, look at that and cut out some of the canker that they are in our system. But that was my personal view, and some will share it and some won't. But of course, I'm not a politician, and if I was, I'd be defending my position to the hilt, I'm sure. But I think also the other thing that's really come out of this pandemic is the issues around workforce. And our colleagues in social care have been the true heroes of this pandemic. Yeah. They've been amazing. But what we've got to do is use that as a platform for some of the reforms around both the professionalisation of our sector, the skills and training competencies, but also about how we pay people. You know, I'm sick of going to meetings at the department where they say things like, oh, how can we improve the status of the adult social care sector? Well, it's quite easy. You pay people as professionals, you respect them as professionals, and you acknowledge them as professionals. You give them training, development, support, and career pathways. That's how you do it. And so in the reform agenda, as we look to the future, I think, you know, workforce needs to be absolutely central to that change. The other area that I think needs root and branch reform is regulation. I think one of our problems is that regulation now is focused too much on processes and also trying to apportion blame. Now, I much prefer the airline industry regulatory process, which is much more about an analysis of critical incidents and learning lessons. So a good example of this, I know a pilot who made a minor error going into Heathrow. At the end of the flight, he shut the plane down. He discussed the error with his team on the flight deck. And the next thing he did was he contacted the regulator. And I said to him, I'm not sure if I'd made a minor drugs error, like giving somebody 2 aspirins instead of 1. The first thing I would do was contact CQC, because I think what they would do is not learn the lesson, but hang me out to dry. So I do think there is a real challenge around where we reform regulation.
I bet he contacted the pilots union first.
Well, probably, probably. But interestingly, that notion that somehow the regulator is a port of call to make sure that you do a real analysis of that action. And sometimes it will just be a mistake by an individual, but sometimes there will be systemic issues that then need to be resolved in order for that mistake not to be made again. And that's the approach I'd like to see in social care regulation.
I would say, in terms of regulation, from a business broking point of view, certainly over the last 3, maybe 4 years, originally for us, the majority of our clients originated from retirement. Retirement was the #1 reason. They're passionate about the sector, as all of the owners are, but it was time to retire. Now, what we're finding is people are coming to market at an earlier age, and the #1 reason is regulation. They feel there is such a disconnect between CQC, or Ofsted if it's child-centric care services, and the operation, as though there is there's a lack of joined-up working relationship, that there is a catch-you-out mentality, and to the point where people are now, it's really good quality operators, are just deciding they've had enough.
Yeah, I think that's right. And I think that we've got to change that. And that's why I'd like to see also some real accountability in terms of the career pathways for inspectors. And I'd really like also to see some opportunities for people in practice to go into inspection and back into practice and some of those things. So I think there needs to be a bit of a root and branch reform there. I think also as a sector, though, we need to embrace technology more, and I think that will be something that will come out of this pandemic. People will start to do that because they've been forced to do it during COVID, and they'll be seeing the benefits of it. So that, I think, will be positive. But I'd also like to see the government develop some kind of technology fund that enables care to really grasp the technology agenda and work very effectively with it. And of course, funding has got to be reviewed, but not only the amounts of money, but also the distribution networks. I am absolutely convinced that local authorities are not a good way to distribute resources, because what happens is they come up with 300 plus of different agendas. There is no accountability trail. And, you know, people say nonsense to me like, oh, you know, they stand for election once every 5 years. Well, so what? In relation to this particular issue, there is no accountability trail. People are laws unto themselves, and that's not helpful in trying to develop a system that should be innovative and delivering for citizens' needs. So I think those are my overarching sort of hopes for the future. And this will be built, I hope, on experiences of both COVID and before COVID. And we should come up with something which is much better for the future. So I don't know if you've got lots of questions there, Andrew.
Yeah, I have. What I'm going to do is I'm going to give you a little 30-second breather. I've got 3 quick polls that I'm going to launch for the attendees, so you can take a nice little pause there. So I guess, bit of a pulse check with regards to where people are at. And I'm very interested to know if anybody, well, not if anybody, but the sort of timeframes people are looking to acquire healthcare businesses. Despite the pandemic, we've been very robust with our levels of instructions and the sales that are going through. So I guess if people would like to share this information, it gives us a pulse check on where they're at. Okay, so 3, 2, 1, and I'll close that poll. And a bit of a plug, so apologies for this, but is anyone interested in working with us? We have a fantastic healthcare team, and if you are interested in acquiring or selling, I would love to hear from you. If you click yes or no, nice easy poll before one more, and then we go back to Martin. And then finally, and there's a lady who's actually on this webinar, who's on one of my first webinars. We launched a money saving scheme for healthcare operators as we entered the pandemic, predominantly focused on energy tariffs. I have to be honest, I have been shocked at how many people are operating care businesses who are out of tariff. And we had one lady who had 3 homes who's now saving £75,000 a year on her energy, just by a quick review, and we can see whether you're on a good tariff or not on a good tariff. So a couple more seconds there before we go back to Martin, and I will be firing questions at him. So I'm just going to close that. 2, 1, brilliant. Okay, right. So question from Raymond Martin. Do we expect any extra funding for the care sector to be announced by the government?
I don't think we'll see a lot of extra funding. I think we've got some extra funding in terms of the Infection Control Fund, and that will run for about another 6 months. Though, of course, the second tranche of funding is not as generous as the first, and it takes over a longer period. But I don't think that we will see significant amounts of extra funding, and partly that's because the government now is starting to talk about a root and branch reform and their change agenda for care.
Do you think their change agenda, and obviously Boris has been fairly vocal for a prime minister, do you think it's a way of delaying the extra spend, or is it a genuine desire to once and for all solve the key issues?
Yeah, I think it's a bit of a genuine desire to want to solve the issues, but also it's a recognition that they can't go on as they are. And I think COVID has really shown that. So there is a real now need as well as a desire to do the reform agenda.
Okay. Question from Chirag. Do you think COVID will accelerate the loss of bed provision in the UK?
I think it may do in the very short term, but not in the long term, because the bottom line is, if you look at the demographics, we are going to need more provision. And also this notion that everybody in the local authority seems to have, which is that people can be effectively managed in their own home. Well, let me tell you, they can if you put 6 or 8 people doing 24-hour support. They can't if you do what local authorities are doing at the moment, which is taking people with very high level needs and giving them minimal community support, and also doing it by, in some cases, the minute, never mind the hour. So I think we've got to have a root and branch reform of a much more outcome focused approach to commissioning both community and residential care.
Okay, a question from one of our team members, Sam Fazakli, which I will wrap into a question from myself, is, in the past couple of months, Paul Miller and myself have been writing to our MPs and ultimately to Rishi Sunak, because in our opinion, we think the commercial lending market in the UK is broken. And we do not believe that the British Banking Association or that the British banks are actually doing their job properly. And we see it in the healthcare sector. We see proven, credible operators who seek to grow as part of a business expansion, who are sometimes unable to acquire funding, or if they do acquire funding, it's at 50% or ridiculous T's and C's. This, we feel, is holding back growth in quality, expansion, and things like technology, for example, because what you find is The younger or the smaller, more nimble entrants are usually quite dynamic with some of this. Do you think that the government will ever step in and look at the sector and work with the sector to get the banks to offer more commercial funding?
Well, I don't. And the reason I don't is because it's not necessarily a government thing, it's a societal thing. When we had the banking crisis, then of course everybody decided that bankers were bad. And also the bank system then also had to deal with much more regulation and much more expectations about what they wouldn't do as opposed to what they would do. And this is a challenge in any society like this, which is that when something goes wrong, the whole of the system goes into a spasm. And what they always do is that if Joe Bloggs creates a problem, they legislate for the rest of the 70 million of us who didn't create a problem. And I think one of our challenges is that we always see this. Whenever there is something identified, then government goes into spasm in a way. It's a limus blanket for them to say we've done something. So a good example of that as well is things like the market oversight regime at the Care Quality Commission. When you look at what happened at Southern Cross, the sector and indeed some commissioners and the people at the Department of Health all came together, and we didn't see a massive challenge because of that, because the sector dealt with it. But then politicians had to say, oh God, we brought in more legislation. And what politicians tend to do is they judge their effectiveness by the number of bills they can bring forward or the number of checks and balances they put in the system. Or when somebody moves to the left, they think, let's put them in a straitjacket so they can't move back slightly to the right. So I think this is part of the challenge that we face. We're not living in a world that is necessarily entrepreneurial. We're living in a world now of backwatchers.
Okay. Well, we will keep lobbying on our behalf to hold them to account. A question from Sheila. Ooh, why are local authorities and the government ignoring the minimum cost of care as set by UK HCA?
Because they can get away with it. And one of the challenges is, and one of the things that always is thrown back in my face, when I say this is an unsustainable rate that X, Y, or Z authority is offering, what those authorities say to me is, well, members are actually putting up for those contracts. So if you do not follow the UK HCA model and you then put out a tender in your locality, the only thing that will force them into raising the stakes is if nobody tenders, because it's not viable. And what we've seen, particularly in domiciliary care, is lots of business failures, but they're always then followed by people who jump in and say, oh, yes, well, we can take that business. So I think partly the sector, and I realise why they do it, is because it's survival and the fact that they want to maintain their businesses. But as long as we accept unsustainable funding levels, then local authorities will continue to give them.
Okay, thank you. Question from Jacqueline. Any thoughts on day services? We did not furlough any of our staff on the back of our county council confirming they would maintain funding. This was cancelled mid-August and we were not able to join the furlough scheme. We are now facing closure of the service.
Yeah, I mean, I think this is an area where we've got to start developing more day services. These are vitally needed. And unfortunately, these are seen as add-ons rather than essential in our current system. And that's why within the new vision for social care, we need to understand the important role day services play, because they can make the difference between, for example, carers being able to manage and support somebody and not. And also there are so many ways in which if you give good quality interventions early, you can stop people going into later crisis. So I think I really appreciate what's been said there, because these are services that are too valuable to lose, but nobody in the system is acknowledging that. Okay,
good question. Just a quick one from me. Prior to commencing today, we were chatting about the statistics that you've seen, obviously as part of many statistics you see on a daily basis, about how the illness is changing and how the statistics are changing. Could you just quickly cover that off? Because I think that would be useful for the audience.
Yeah, well, certainly as this pandemic has started to develop, what we've seen is there are much better ways of managing it. And also now that the NHS has not withdrawn from care services, we're seeing significant increases in the number of cases that are coming through. And particularly that's linked to local areas. So if you have a local area with a high level of cases, that tends to translate into care services. But what we're seeing is death rates are not nearly as high as they were at the start of the pandemic. So partly that might be about the better interventions from the NHS and also the better understanding of how to treat and manage and support people with COVID.
Okay. Final question. Where do you think the market for care will concentrate towards? Do you think the benchmark of entry will get higher and therefore fees to cater for a more intensive care plan profile?
Yeah, I do. I think what will happen is the market will be about delivering that high level complex care. But of course, if we have a new vision for social care, we need to understand that before people get to that level, they need also to get support, and it needs to be integrated within the prevention agenda, and we need to see downstreaming. And that was why the question about daycare was so important. We need to see more services like that that support people to live well before they go into complex crisis.
Okay, that wraps us up today. Martin, thank you very much for your time. This has been fascinating. It's been an absolutely fantastic webinar. And so on behalf of myself and Care England, thank you for the work which you do. If anyone is on the webinar today who is in the care sector and is not a member of Care England, I would urge you to go to the Care England website, look at the fantastic work that they do, and look to register and sign up with them. It was really the press coverage of the significant factors affecting this sector were driven by Care England and some of the data, obviously, but it is only through the work of people like Martin and people who can lobby the government that we can actually get real change to happen. So thank you very much, Martin.
Thank you, Andrew.
Enjoy the rest of your day. And I am going to end the webinar. Thank you.
Thank you.